Ladies and gentlemen, there is a man, the University of Montana, that's claiming, they're developing a vaccine for opioid addiction, which I'm not buying. I'm just not buying. There's a vaccine for this. And you notice drug addiction keeps morphing into something else. And how do we know what he's doing with this vaccine for opioid addiction is not going to turn into another addiction? Number three, opioid addiction is one of the hardest to beat. I read an article probably more than 2 years ago, more like 3 years ago, and it was saying that 90% of the people that come out of rehab relapse within a 2 week period of completing their time at a rehab center. They have a relapse. The ratio of people not going back to the drug is extremely low. Most people just simply don't beat this addiction. Even after several tries, they don't beat this addiction. And that is pretty much the norm in this whole thing. So, this man showing this vaccine, I'm just not buying it. I'm not buying that a vaccine is going to cure opioid addiction, y'all. I'm just not buying it. So, researchers craft vaccine for opioid addiction. And my question is, what kind of side effects are going to come from this vaccine? And how often do they have to get this vaccine? You know, I don't know. I'm just not buying all you got to do is give a drug addict a shot and they're over their addiction. I'm just not seeing it. In 2017, an estimated 2.1 million Americans suffered from an opioid use disorder. A research team at the University of Montana aims to keep them from overdosing and helping them quit with a vaccine. People who want to quit often enter a rehab program, but the relapse rates are very high the first 2 years after a patient come out of rehab, says Jay Evans, director of UM's Center for Transitional Medicine. People who want to quit could benefit from a vaccine to help them through the critical period when the relapse rates are high. I'm still not feeling this, y'all. Evans and his team of researchers at UM and Minnesota recently received $3.3 million grant from the National Institute of Health to develop a vaccine for opioid addiction. It's one of several awards the center has received since its launch in 2016 when GlaxoSmithKline Vaccines closed its Hamilton research office and its scientists negotiated employment contracts with The National Institute of Health have since recognized the Center research prowess, awarding its $22.4 million in other grants this past summer and fall. Now, they're a few weeks into a years long effort to make an opioid addiction vaccine a reality. I'm not feeling this, y'all. I'm just telling you, I don't believe this. I don't believe it. To most people, it's strange to think using a vaccine to treat drug addiction, Evans acknowledged, but in one of its labs Friday, it explained how a vaccine can train the body's immune system to target opioids in the same way it targets flu or tuberculosis. And y'all remember this past season, the flu vaccine was completely ineffective. I want you to remember that. The flu vaccine for actually the last 2 years in a row. Last year as well. That's why you had all of those flu deaths. And you had some this year. And they had to concede that the flu vaccine, I think, was only 21% effective. That was it. Most people that had the flu vaccine weren't even covered from the flu strain that was out. But they keep pushing the flu vaccine despite the fact that it's been ineffective for the last few years. So if he's comparing this to a flu vaccine or tuberculosis, I'm just telling you, I'm not impressed just from listening to that. So, and he claims this is going to help patients to avoid overdose or relapse of the drug, which I'm not buying. We take the opioid, modify it to make something called hapten, and we link it to a carrier protein, and that allows the immune system to recognize it, he said. The opioid and carrier protein are packaged with a third chemical called an adjuvant that prompts the immune system to recognize the hapten and respond like a plume of smoke, alerting firefighters to a blaze. With the right combination of adjuvant, carrier protein, and hapten, the researchers say they could train the antibodies to attack a drug when it hits the bloodstream. I don't know, y'all. I'm I'm still asking, what are the side effects to this whole thing? What are the side effects? Because if you remember, there were a few stories I did on people getting a flu vaccine, which he's comparing this to, and they became paralyzed. In fact, it was a few people, and I did those stories too. So, my question is, what are the side effects, and how are they going to give this vaccine to a bunch of addicts in America? And we know the average addict don't go to rehab. In fact, most of them, the majority of them, refuse rehab. So, that being said, ladies and gentlemen, how many people is this really going to reach? You don't believe me? Pull up any video where they talk about rehab around drug addicts and they damn near cuss you out, or they'll walk away from you telling you they don't want no damn rehab. So you create this vaccine, and how many people are you going to reach with it? And number two, when is it effective? How long does it take to be in your system to build up any effectiveness? You know, I don't know. I'm never impressed with vaccines, but so they're saying as long as the antibody response is high enough in the bloodstream when the patient relapse after rehab and uses the drug again, the antibody binds to the drug and prevent it from crossing the blood brain barrier. So they see no effect from the drug abuse, Evans said. Not only does that prevent a relapse, keeping it out of the brain should also help prevent overdosing, which kills an estimated, yeah, they were saying 130 a day. There's no way it's that low after all this time. That's a bogus number. Okay, ladies and gentlemen, I don't know. Are you buying this? Are you buying a vaccine for opioid abuse? I'm not buying it. I don't care how much they keep explaining it. I'm not buying it. Okay. Now, it looks like they did some testing on mice during a round of tests for potential adjuvants. She said the team tested vaccines on 250 mice. Three people harvested tissues while four others examined the effects. It's a huge team effort, she said. It's also a time consuming, Evans said. A typical study with mice can take up to 2 to 3 months. So he's not really telling you the results of them giving this vaccine to mice. Okay, he's not telling you anything. So, ladies and gentlemen, please tell me what you think about this. Okay. All right. So he's just talking about how many people they got working on the vaccine. But I don't know. I'm just not believing all you got to do is give somebody an injection and they beat drug addiction to opioids. I'm sorry. I'm just not buying it, y'all. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.